Hello, welcome to Behavioral Health 107, Mental Health Disorders. Today we'll be discussing substance use disorders. In 2013, the revised version of the DSM replaced the terms substance abuse and substance dependence with the term substance use disorder. It is defined as mild, being 2 to 3 symptoms, moderate, 4 to 5 symptoms, and severe, 6 or more symptoms. The level of severity is determined by the number of diagnostic criteria met by the individual. The symptoms fall into 4 major groupings: impaired control, social impairment, risky use, and pharmacological criteria, i.e., tolerance and withdrawal. The revised DSM describes a pattern of using of an intoxicating substance leading to clinically significant impairment or distress as described by at least 2 of the following symptoms occurring within a 12-month period. The substance is often taken in larger amounts or over a larger period than was intended. There is a persistent desire or unsuccessful effort to cut down or control the use of the substance. A great deal of time is spent in activities necessary to obtain the substance, use the substance, or recover from its effects. For those of you who have not seen the movie that Jared Leto and Ellen Burstyn appear in, and it's from the early 2000s. It's called Requiem for a Dream. It pretty much defines drug addiction in the most basic way of how much time is spent having to get the drugs, getting the money for the drugs, and it really does capture everything you need to know about addiction and substance use disorder. Number 4, craving or a strong desire or urge to use the substance. Number 5, a recurrent use of the substance resulting in a failure to fulfill major role obligations at work, school, or home. Number 6, continued use of the substance despite having persistent or recurrent social or interpersonal problems caused by or worsened by the effects of its use. So, your family leaves you, you get fired from work, you lose your license, none of these things matter. The only thing that matters is getting the drug and continuing to use it. Number 7, important social, occupational, or recreational activities are given up or reduced because of the use of the substance. Number 8, recurrent use of the substance in situations in which it is physically dangerous. Number 9, use of the substance is continued despite knowledge of having a persistent or recurrent physical or psychological problem that is likely to have been caused or exacerbated by the substance. For alcoholics, one of the big problems they often encounter is cirrhosis of the liver, and despite the physical manifestation of the liver actually swelling to the point that they can see it, they will continue to drink. Then we move into tolerance, which is defined by either of the following: a need for markedly increased amounts of the substance to achieve intoxication or the desired effect, a markedly diminished effect with continued use of the same amount of the substance. So in other words, you need to use more of the substance to get the same kind of feeling that you are chasing. There's a term for heroin users and opium users called chasing the dragon. And of course, dragons are mythological creatures, despite what Game of Thrones might have you believe. And that's the key, is that you will never get that perfect high that you got that first time. Number 11, withdrawal as manifested by either of the following. The characteristic withdrawal syndrome for that substance that often includes painful physical and psychological effects on the individual. With some of the medications or pharmacological drugs, people might hallucinate. They might feel like there are insects crawling under their skin. They might have terrible stomach pains. So it is really an unpleasant experience. The substance or a closely related substance is taken to relieve or avoid the withdrawal symptoms. So why do people use substances? Well, primarily they obtain pleasure, joy, and euphoria. It makes them feel better. And, for those of us who occasionally indulge in a good night of drinking, we have fun. We meet our social expectations. We go to a wedding with an open bar and we party our butts off. When we're young, we give in to peer pressure. You go to a party and someone is smoking a joint or a blunt and it's puff, puff, pass. And you feel like a dork if you don't take part. Other people, they use drugs to deal with or escape stress, anxiety, and tension. People use substances to avoid pain. A lot of people who are heroin addicts started because they were involved in an injury, sports-related or a car accident, or a work injury. They were given pain pills. Eventually they were cut off by their doctor, and it's fairly easy and inexpensive to move on to heroin. And finally, the altered state of consciousness. Some people are keenly interested in trying to achieve different states of consciousness. They want to, try peyote, try LSD to see what their brains will experience. And again, this is not always a good thing, but everybody has their own reasons for trying these substances. So what is addiction? Addiction is defined as a chronic, relapsing brain disease that is characterized by compulsive drug seeking and use despite harmful consequences. Now, this is a significant difference than what we were talking about addiction many years ago. Previously and currently in many areas of the country, addiction is seen as a character flaw, as a person who is weak and cannot handle their life, so they resort to numbing themselves with these different medications and substances. The fact of the matter is, these substances change the way your brain works. They change the structure and they change the way the brain functions. So these brain changes can be long-lasting and it can lead to many harmful, often self-destructive behaviors. Even after a person stops using the drugs or the substance, the person has the potential to relapse and begin using again. So what we have to keep in mind is that our brains and the study of our brains are a relatively new science, and we are just beginning to understand how addiction actually works. Consequently, when we look at addiction now, we realize that it is not just about some sort of issue where people are poor and they started smoking crack because somebody told them that it was a good way to get away from their troubles. The reality is some people are predisposed to addiction, whereas other people are not predisposed to addiction. So what is dependency? This refers to a change in the nervous system so that a person now needs to take the drug to prevent the occurrence of painful withdrawal symptoms. You become dependent when if you don't take the meds or the drugs, your body goes through a terrible withdrawal process. What are illicit drugs? Based on federal government data in the United States, the following substances are considered illicit drugs, meaning Schedule I drugs. Marijuana and hashish. Now this is one of those very interesting things because in some states we have legalized recreational marijuana. So, for example, in Colorado, you can go into certain shops and buy marijuana and go to your home and smoke it, and it is perfectly legal. However, based on federal government laws, it is still illegal. So there is a clear inability between state government and federal government to agree on what is okay and what's not okay in terms of marijuana and the legality of it. Adding to make this even more complicated is that the American Medical Association has identified several uses for medical marijuana that are extremely helpful, especially in controlling seizures for children. Now, I don't want you to think of a little 5-year-old smoking a blunt. Instead, they make a oil or a tincture of marijuana that is given to the child orally, just like if you think of liquid Tylenol, and it stops the seizures. And you can go on YouTube and see these seizures literally stopping. So you can see how children go from having 100 seizures a day to literally none. So there's a huge movement in this country to have medical marijuana legalized across the board. And it is legalized in half the states in this country. So there's a huge controversy in this country about whether or not it should be allowed medically or whether or not it should be allowed recreationally. Now, the rest of these drugs are pretty much understood that there are complicated issues surrounding them. Cocaine, including crack, which is a cooked version of cocaine, heroin, hallucinogens like LSD, inhalants like glue and computer cleaner, and then we have our prescription type psychotherapeutics like pain relievers, tranquilizers, stimulants, and sedatives, and they are being used non-medically. So, for example, somebody might get a pain pill like a Percocet, and what they would end up doing is crushing up the pill, snorting it, or taking benzodiazepine, which is like a Xanax or a Valium, and taking multiple ones of those and maybe adding it to a marijuana cigarette and attempting to add a little chill to their already chill cigarette. So, what drugs are actually being used? And this is data from 2013. Marijuana is the most commonly used drug, with approximately 20 million Americans having used it in the past month. And those are the Americans who are willing to admit to having used it. Heroin and prescription opioids, painkillers, are used by almost 2.5 million Americans. Approximately 1.5 million Americans use cocaine or crack, and hallucinogens are used by 1.3 million Americans. So we're seeing a huge number of Americans using these illegal drugs. Keeping in mind that the United States is the single largest user of illegal pharmaceutical and drugs in the world. So, what about alcohol? It is the most commonly used substance in the United States, with approximately 52% of Americans using it, which is approximately 176 million people. So you go out to dinner, you have a glass of wine. It does not mean that you have a problem. It just means that you're using it, and alcohol is in fact a substance, keeping in mind that in the early part of the 20th century, during the era of Prohibition, alcohol was illegal. 60 million Americans have admitted to what we call binge drinking in the past 30 days. So that is a third of all drinkers have admitted to binge drinking. Binge drinking is defined as having 5 or more drinks on the same occasion on at least one day of the 30 days prior to the survey. 16.5 million Americans report that they are heavy drinkers. Heavy drinking is defined as binge drinking on at least 5 days in the past 30 days. So you do see, because it is more socially acceptable, people are more willing to admit to being heavy drinkers or binge drinkers. Now, for those people who have a substance use disorder with alcohol, this is called an alcohol use disorder. And it increases a person's risk of developing serious health problems in addition to those issues associated with intoxication behaviors and alcohol withdrawal symptoms. According to the Centers for Disease Control and Prevention, excessive alcohol use causes 88,000 deaths a year. That is an enormous number of deaths. It is estimated that from the National Survey on Drug Use and Health that approximately 17 million Americans have an AUD. So when we look at this disorder, we're looking at a fairly large section of the population. And of this fairly large section of the population, many of them are not seeking help because it is a socially sanctioned disorder. You know, it's okay to go out and have a couple drinks. It's okay to go out and have 3, 4, 5 drinks every night, or stay home and have a 6-pack every night. So, in terms of how do we treat people who are seeking assistance for alcohol use disorders, medication can be very helpful because, again, remember, it's not a character flaw. It's not about being weak. It's about a person who has changed their brain chemistry. So, acamprosate reduces symptoms of protracted withdrawal and has been shown to help individuals with alcohol use disorders who have achieved abstinence go on to maintain abstinence for several weeks to months. One of the big problems when somebody goes cold turkey from alcohol is that they do have hallucinations, physical delusions like the bugs crawling under their skin. Naltrexone has been used to reduce cravings in those with alcohol use disorder. And again, your brain is telling you that you are craving this. Disulfiram is another medication which changes the way the body metabolizes alcohol, resulting in an unpleasant reaction that includes flushing, nausea, and other unpleasant symptom if a person takes the medication and then consumes alcohol. So for some people, they just can't help themselves. So they take this medication, and when they drink, they get sick. So you go back to, what we learned with B.F. Skinner and our negative reinforcement, and, we take our meds, we then get sick. So our body rewires itself to understand that alcohol would then make us sick. Another huge issue in this country that, again, is socially sanctioned is tobacco use disorder. An estimated 67 million Americans use tobacco products, which is approximately 25% of the population ages 12 and above. Although smoking has declined significantly over the past few decades in the United States, young adults have the highest rate of tobacco use. Again, who starts smoking? Does your average 35-year-old wake up one day and go, wow, I think I'm going to have a cigarette today? No. Generally, the people who start smoking are young teenagers. Among teenagers aged 12 to 17, there is a significant correlation, almost 54%, between smokers and users of illicit drugs compared to non-smokers and users of illicit drugs. So in terms of gateway drugs, and this is one of those big conversations people love to have, if you want to look at a gateway drug, tobacco is a big gateway drug. We don't like to talk about it because in the United States, the tobacco industry is a major industry that has a huge lobby effort in Washington, and they pay Congress a lot of money to maintain their place in the market. Tobacco use and smoking do damage to nearly every organ in the human body, often leading to lung cancer, respiratory disorders, heart disease, stroke, and other illnesses. Now, remember, alcohol disorder use causes about 88,000 deaths a year. Tobacco is linked to an estimated 480,000 deaths per year. Almost 500,000 people a year die from tobacco-linked issues. And this is from the Department of Health and Human Services in 2014. So we have a product on the market that kills about 500,000 people a year. And any other product that killed this many people every year would be questioned. But because it is part of a huge economy that donates a lot of money to the American government in terms of paying for our congresspeople and our senators to get reelected, this industry is not going to be curtailed except by public outcry. And that's the only reason that they are no longer advertising on television. So how do we treat tobacco use disorder? We have non-prescription. Nicotine replacement medications assist with reducing nicotine withdrawal symptoms, including anger, irritability, depression, anxiety, and decreased concentration. Because nicotine delivered through chewing gum contain nicotine via transdermal patch or in lozenges has a slower onset of action than does the systemic delivery of nicotine through smoked tobacco, these medications have little effect on the craving for cigarettes. So a lot of people end up using a prescription type. The nicotine inhaler and a nasal spray deliver nicotine more rapidly to the brain and are so available only by prescription. Now just take a moment. Nicotine is a stimulant. When we feel tired, when we need to concentrate, that's when our body craves a cigarette. In the same way that when we wake up in the morning, we want a cup of coffee, we also, for those of us who may be smokers, oftentimes want a cigarette as well. Wellbutrin is a medication originally developed and improved as an antidepressant, but was also found to help people quit smoking. Varenicline is a nicotine partial agonist that reduces the craving for cigarettes and has been helpful in smoking cessation for many. So, smoking is a tough situation. People get addicted before they're even the age of 18. They have a hard time quitting. And, the reality is, for many of these folks, is that they are not even mature enough to understand what tobacco can do for them before they have already become completely addicted to it. So we're going to move on to cannabis use disorder. Cannabis is the official name of marijuana. About 22 million people have used marijuana or hashish, which is the dried resin from the top of the female cannabis plant, in the past year. Heavy marijuana use in the teen years has been linked to poor cognitive function and poor impulse control. Early research suggests a correlation between adolescent males at risk for schizophrenia and early onset of the disease. And just to be clear, if you do not have schizophrenia in your family, it doesn't mean that you can catch schizophrenia from marijuana. It just means that if you are already at risk for schizophrenia, it can bring on the onset of the disease. Researchers from the University of Warwick have found evidence to suggest a significant relationship between cannabis use and the onset and exacerbation of mania symptoms in bipolar patients. Other issues with cannabis can include things like it reduces a male's sperm count. So men who are going to have children often are told to stop smoking pot because their swimmers are literally sitting on the couch and eating Cheetos and not swimming. And the reality for a lot of people is that they may smoke a lot of weed when they're in their early 20s, but by the time they get into a relationship and grow up and, have a job, they've moved away from that issue. Then we move into stimulant use disorder. The most commonly abused stimulants are amphetamines, methamphetamine, and cocaine. Stimulants can be synthetic, such as amphetamines, or can be plant-derived, such as cocaine. They are usually taken orally, snorted, or intravenously. A stimulant like methamphetamine, which is synthetic and created by people who generally have a very basic understanding of chemistry, are using all kinds of weird stuff in methamphetamine. And the consequence is that you have a person, and you'll see the pictures, at age 22, cute young lady, and by 33 she looks like she's in her 50s. Methamphetamine has things like Drano and battery acid and alkalines in it, and will rot your teeth and cause sores all over your body. There's just a variety of fun and exciting side effects to this kind of drug. Based on the numbers compiled in 2014, people who have stimulant use disorder, just under 1 million have problems with cocaine and crack, 569,000 with methamphetamines, and 476 for stimulants other than cocaine and methamphetamine. Now on the right-hand side here, we have a picture up at the top of Whitney Houston when she first came on the scene in the 80s. Cute, great voice, and then on the bottom is a picture of her shortly before her death. And she was a heavy crack and cocaine user, and clearly you can see that drugs will do a number on your physical look. And for those of us who heard her sing in the last few years of her life, it was also doing a number on her magnificent voice. Moving on to hallucinogen use disorder. These are hallucinogens can be chemically synthesized, as with lysergic acid diethylide or LSD, or may occur naturally, as with psilocybin mushrooms or peyote. These drugs can produce visual and auditory hallucinations, feelings of detachment from one's environment and oneself, and distortions in time and perception. Approximately 246,000 people suffer from hallucinogen use disorder, so just under 250,000, not a huge number compared to the rest. So let's talk about opioid use disorder, because this is a huge issue in this country. Opioids are meant to reduce how we perceive pain. They also produce drowsiness, mental confusion, euphoria, meaning we have this feeling of joy, nausea, and constipation. Constipation meaning we can't use the bathroom, our bowels are blocked. And this occurs because opioids slow our digestive system down to a crawl. Depending upon the amount of drug taken, it can also depress our respiration. Opioid use disorder is a huge problem in this country, and opioids come in legal form, such as prescription painkillers, such as Percocets or Oxycontin, and in illegal form, such as heroin. People misuse opioids to try and intensify their experience by snorting or injecting them. Some users switch from prescription painkillers to heroin because it is cheaper and often easier to get. Overdoses with opioid pharmaceuticals led to almost 17,000 deaths in 2011. Since 1999, opiate overdose deaths have increased 265% among men and 400% among women. Those are huge increases. In 2014, an estimated 1.9 million people had an opioid use disorder related to prescription pain relievers, and an estimated 586,000 had an opioid use disorder related to heroin use. So when you're looking at these numbers, and it comes out to just about 2.5 million people, almost 2 million of them are related to prescription pain relievers. And again, this is where we get into governmental regulations. Pharmaceutical companies pay lobbyists a huge amount of money to go to Washington to maintain the legality of doctors writing prescriptions for these medications that are extremely dangerous. It was so out of hand that in Florida, you could go in with just your license, see a doctor for less than 5 minutes, and get a prescription for opioid pain relievers. They had to, a few years ago, go in and shut these places down because the number of people who were addicted to opioid pain prescriptions had skyrocketed and overwhelmed the Health and Human Service Department in Florida. The issue here is not just the number of people, but what you also had were people from Georgia, North and South Carolina, coming in, buying at all of these little clinics, and then moving the medications to the north and then selling them at a premium, $10 a pill for Percocet, whereas you go to the pharmacy and it may cost you $8 for the entire 30 pills. So it is quite a big business, and the pharmaceutical companies make a ton of money. And until the government wants to step in and really put a kibosh on some of this, it's just going to keep getting worse and worse. And the heroin use is going to continue to increase because people can't always afford opioids, and heroin again is going to be much cheaper. Now, where does the heroin come from? Well, heroin comes from primarily Afghanistan, where we are still fighting a war, and they ship in their heroin to the United States because we are the highest drug using country in the world, and it is a way for them to subvert the American way of life by utilizing this drug that is so popular here. The Taliban controls the heroin drug trade in the country. So how do we treat this stuff? Opioid agonist therapies with methadone or buprenorphine or Suboxone reduce the effects of opioid withdrawal and reduce cravings. They have been shown to increase retention in treatment and reduce risk behaviors that lead to transmission of HIV and viral hepatitis, such as using opioids by injection. So again, what you happen to see is that there are people who crush up their pills, they inject them, they might keep using the same needles over and over again. They might share their needles, and this is how HIV and hepatitis manage to jump from person to person. Medication-assisted treatment with extended release injectable naltrexone reduces the risk of relapse to opioid use and helps control cravings by removing the pleasure feelings in the brain. Extended release injectable naltrexone is useful for people in a controlled setting where abstinence has been enforced, such as a jail or a residential rehabilitation. Now, people who've been in jail will tell you that it is just as easy to get drugs in a jail as it is out of a jail. So there are, significant issues. Suboxone is one of those drugs where they're looking to be able to put it into a person, much like a birth control, where it works under the skin slowly, releasing over a course of 30 or 90 days so that the person doesn't even have to think about it. The key here is it is hard to get FDA approval because it is a one-shot deal every 30 or 90 days, and the drug companies don't make as much money on it. So, can we stop an opioid overdose? Absolutely. There is a medication called Narcan or naloxone. It is an opiate antidote. When a person is overdosing on an opioid, breathing can slow down or stop, and it can be very hard to wake them from this state. Narcan is a prescription medicine that blocks the effects of opioids and reverses an overdose. Many communities distribute this to police and EMTs. Some communities will distribute to the general public after a short training session. And again, here's where politics comes into play. Where I'm from in New Jersey, our neighborhood every month runs a general public training session. So if your child or spouse or loved one has a heroin or opioid problem, you can go, you can get trained so that if you come home or if you find your loved one overdosing, you can save their lives. But in other states that tend to be much more conservative, they see drug addiction, especially opioid addiction, as a character flaw, and they absolutely refuse to allow EMTs or the general public to utilize these kinds of medications, which is just ridiculous. And yes, I'm editorializing, but also, the more we know about how the brain works, the more we understand that it is not about person being weak, it's about a person's brain being rewired. When a person is addicted to an opioid, their brain no longer makes endorphins, and it has to be rewired so that it learns how to make them again. And again, what you begin to see is the more information we have on this, the better we're able to treat it. So let's talk about a general treatment system for substance use disorders. There's multiple service components, including individual and group counseling, inpatient and residential treatment, intensive outpatient treatment, partial hospital programs, case or care management, medication, recovery support services, 12-step fellowship, and peer supports. A person accessing treatment may not need all of the components, but each plays an important role. Treatments for youth often involve a family component. Two models for youth that have been used in combination have been supported by SAMHSA grants are the Adolescent Community Reinforcement Approach and the Assertive Continuing Care. Individual counseling often focuses on reducing or stopping substance use, skill building, adherence to a recovery plan, and social, family, and professional educational outcomes. Group counseling is often used in addition to individual counseling to provide social reinforcement for pursuit of recovery. Cognitive behavioral therapy teaches individuals in treatment to recognize stressors and stop negative patterns of thinking and behavior, i.e., relying on substances to self-medicate. Contingency management is designed to provide incentives to reinforce positive behaviors such as remaining abstinent from substance use. Motivational enhancement therapy helps people with substance use disorders to build motivation and commit to specific plans to engage in treatment and seek recovery. It is often used early in the process to engage people in treatment. 12-step facilitation therapy seeks to guide and support engagement in 12-step programs such as Alcoholics Anonymous or Narcotics Anonymous. One of the bigger issues that often come along with this is that Alcoholics Anonymous and Narcotics Anonymous often focus on giving up your control to a higher power. And a lot of people who are not overly religious find this uncomfortable. So there have been other groups that have stepped in that are not so religiously focused and focus more on self-determination. Treatment in an inpatient or residential settings can happen within substance use disorder, within specialized treatment units or rehab centers, residential centers. The standard is 28 days. Pretty much every single professional in the substance use disorder field tells you 28 days is not enough. 90 days would be much better. However, insurance companies dictate the amount of time that's allowed. Weirdly enough, insurance companies also pay lobbyists a ton of money to go to Washington to convince Congress and senators to keep rules the way they are. The focus on this situation in rehab is detoxification, also known as medically managed withdrawal, as well as providing initial intensive treatment and preparation for a return to community-based settings. So oftentimes when a person goes into rehab, they are a true mess. They may not have been sober for many, many days, weeks, months, maybe even years, and they need to detox before any kind of therapeutic interventions can be applied. Outpatient treatments are programs where people attend very intensive and regular treatment sessions multiple times a week early in their treatment for an initial period. Individuals often step down into regular outpatient treatment, which meets less frequently and for fewer hours per week to help sustain their recovery. So you may go into rehab for 28 days and then you come out and you go into an outpatient program where you meet 3 or 4 times a week, and then eventually you only go once or twice a week, tapering off until you have achieved what they feel is a good chance to sustain your recovery. Now, medication is also a good way to maintain one's sobriety, and it is often used in combination with counseling and behavioral therapies. It can reduce the cravings and other symptoms associated with withdrawal from substances, and it does this by, number one, occupying the receptors in the brain associated with using that drug, and those are called agonists or partial agonists. Block the rewarding sensation that comes with using a substance, otherwise known as antagonists. So when we start using a drug, we get this reward, a pleasure reward. And if you think of chocolate as a drug, every time we have chocolate, we get this little tingling sensation in our brain. It makes us happy. And certain times of the month, many of us may crave chocolate. And until we get that piece of chocolate, that craving never goes away because we're waiting for that reward sensation in our brain. And it is the same thing with these drugs. So these antagonists block that reward sensation. So if we had an antagonist that blocked the reward sensation for when we had chocolate, even if we ate chocolate, it wouldn't give us that reward sensation. Finally, medication can induce negative feelings when a substance is taken. So for example, with that alcohol medication where you take it and then when you drink you get sick, it really does have that effect of rewiring your brain to associate alcohol with feeling sick. All right, here are the works that I've cited in addition to the DSM-5. If you have any questions, please feel free to text, email, or leave me a comment. Otherwise, I hope you have a fabulous day.